What is menopause and why testosterone has everything to do with it? Welcome back to Nobody Wants You Healthy. This podcast focuses on explaining the real cause of menopause and how testosterone pellets reliably prevent its symptoms. Undoubtedly, you and most of your doctors believe that menopause arrives when the ovaries stop making estrogen. This assumption is just plain silly, and you do not need a biology course to understand why. Women do not have any menopause symptoms between birth and whenever their ovaries start producing estrogen, meaning that there were no menopause symptoms during the first 12 or so years of their life, a time when their ovaries are definitely not functioning. The second easily observable fact is that except for the fertile period of women's lives, female estrogen levels are the same or often lower than a man's. Let's continue with this common sense approach for a minute. Let's look at the health and mood complaints of women in their mid-30s to mid-40s. Most of these women are still fertile, have normal adult female estrogen surges from their ovaries, and have regular menstrual cycles. Yet, many are having significant menopausal symptoms. Clearly, the assumption that failure of estrogen production is the cause of menopause is grossly incorrect. The proven and internationally accepted menopause rating scale can be found in the appendix section of my book, Nobody Wants You Healthy. The early menopause symptoms in these fertile women are sleep problems, such as difficulty in falling asleep, difficulty in sleeping through the night, or waking up early. Depressive mood, which would be feeling down, sad, on the verge of tears, having a lack of drive. Mood swings, irritability or feeling nervous, inner tension or aggression, anxiety, which is an inner restlessness or feeling panicky, physical and mental exhaustion, which creates a general decrease in performance, impaired memory, and a decrease in concentration or forgetfulness. Sexual problems, such as a change in desire or a change in sexual activity or sexual satisfaction, and also joint and muscular discomfort, such as pain in the joints, pain in the muscles, or rheumatoid-type complaints. The real reason for these menopausal symptoms is pretty easy to figure out, and they obviously have nothing to do with estrogen levels in the blood. On average, women by 40 years of age have less than half the testosterone in their blood than they did at 21. And due to the hormone-disrupting chemicals in our environment, such as phthalates, men and women both have about 60% less testosterone in their blood today than they did 55 years ago. Since the average 21-year-old woman is just starting with 40% of the normal pre-1970 levels, and then that low level is being reduced by another 50% over the next 20 years, the tipping point for symptomatic testosterone deficiency is being reached much earlier in her life. In other words, menopause is just a constellation of low testosterone symptoms. As we will see in a future podcast, men with low testosterone experience essentially the same symptoms as women. Additionally, 100% of all the estrogen in both men and women is made inside their cells from testosterone in a one-step chemical conversion. Another question we must ask is, where do women manufacture the testosterone that is needed inside their cells for optimal functioning? This easy question has a complex answer. You see, testosterone is arguably the most important hormone for the survival of the individual and for the species. It controls inflammation, metabolism, immune responses, neurologic functioning and repair, muscle and bone health, and fertility. It is much too important a hormone for nature to trust its production to a single manufacturing system. Without testosterone, we rapidly become infirmed and then die. Men and women manufacture testosterone to varying degrees in multiple tissues, including ovaries, testicles, adrenal glands, and inside most of our cells. Women typically manufacture 80% of their testosterone inside their cells, and only about 20% in the ovaries. Men have about the opposite ratio regarding their testicular production. The evolution of multi-site testosterone production is to be expected for such a critical hormone. Despite the source, it appears that the cellular levels of testosterone are very similar between the sexes, thus allowing for organ transplantation between the sexes to be successful. While testosterone is actively transported from the blood into each cell in most animal species, phthalates and other powerful endocrine disruptors have blocked its production at all sources. Testosterone pellets reverse menopause and many chronic diseases by providing a high, steady state level of the deficient hormone into the bloodstream for months. The cells can then transport what they need inside the cells for healthy functioning. Lastly, let's attempt to answer the question many of you, I'm sure, are thinking. What is my ideal testosterone level? The answer is not so clear-cut for two reasons. The first reason is that blood levels of testosterone only loosely reflect the levels inside your cells, and it is the cellular level of testosterone that determines your health and symptom relief. The second reason is that since all humans make their cellular estrogen from testosterone, and hormone-disrupting chemicals can interact with your unique genetics and cause you to make too much estrogen, unwanted symptoms such as bloating, irritability, anger, fat gain, and breast enlargement can happen if phthalate-induced overproduction of estrogen occurs. Because of this, most men and many women will have a tiny amount of a drug that inhibits estrogen production added into their pellets. Therefore, dosing in women is mainly determined by their individual response to therapy, as measured by the Menopause rating scale and the patient's self-reporting of how they feel. Blood lab values are only useful for general ranges and to indicate something else may be amiss. Since this answer will not satisfy you, I'm sure, I'll tell you that the blood level range in my practice for successfully treated women is between 175 and 375 nanograms per deciliter for about 95% of them. This range represents the blood levels required for many women to restore the intracellular levels to the ideal point. Remember, it's only the tissue cell levels that matter. Well, that wraps up this episode of Nobody Wants You Healthy. I look forward to discussing male menopause next.